everybody. Sorry, I have to be loud or you'll keep chatting. Thank you and welcome back. I hope lunch was to everybody's enjoyment. We've decided on listening to some people's comments to slightly rejig the order for the afternoon. So you'll be happy to hear that we are going to hear from our multi-agency speakers about the early help offer first, and then we will go on to talk about the priorities after coffee. Okay, so slight jig, but I think it will make sense hearing some of the comments that we have. Okay, so firstly I would like to introduce Kath Edwards, who's going to introduce how the Back to Basics review came about, I think. Thank you.
Well, hello everybody. I'm very pleased indeed to be introducing this next important session about Shropshire's early help offer. I think we heard some very interesting and challenging statements from Sue earlier, so I think through the presentation this afternoon we'll hopefully be able to see how Shropshire's broom and handle are going to be set out and work. So the reason I'm introducing this session is because I'm a member of the Shropshire Safeguarding Board Partnership subgroup, and this subgroup commissioned the Back to Basics review of early help. It's been an extremely illuminating and informative review, and as Donna said, has led to the development of the early help offer, which of course will depend very much on a strong and active commitment from all agencies. When Sue was speaking this morning, I think she said lots of things that we can identify with and perhaps echo or give other examples. And one of the things that she talked about was the importance of relationships, and that took me back to my early social work training, which was probably pre all the detailed assessment training that's been delivered. It was at a time about that David will remember, and Sally too, which focused on the importance of the casework relationship and how you treated families with respect, how you dealt with the endings of relationships, very well, and so on. And I think that's something that's really important to hang on to. Whatever your agency, wherever you're working in the system with children and families. So I think that was really, really good. Now, I'm now going to talk a little bit about the context and vision, but before I go any further, I just want to acknowledge the tremendous part that Sophie Meldon has played in leading the review. Many of you will know Sophie, sitting over there near the front, because of her work with partner agencies over a number of years. And she's led the review with much charm, but also determination and tenacity. And she's also organised us very well into delivering this feedback session. So a few words first of all about the context of the review. We've been hearing and thinking about the Munro review this morning. We've also touched on government expectations, which are quite challenging, and the whole context of reduced public spending, impact on organisations and agencies has to be remembered, and that presents us with a challenge, but it also gives us an opportunity, I think, to use the resources that we do have in the best way we can to avoid duplication, and just to make the most of what we all bring to this important area of work. And the other important driver as well was our peer review that David referred to earlier this morning, a review that we had in May that really took a hard look at children's safeguarding in Shropshire, and they certainly confirmed that early help was a key area for us. They were supportive of the work that was already underway by that point, but saying again, be bold, take things forward in a big way. So I think that's what we have done. So the vision is helpful intervention at all levels. We might not like the word intervention. What we mean really is clearly help for children and their families. We want a seamless pathway of support for them, and I'll say a bit more about that in a moment. And most importantly, achieving good outcomes for and with children and their families. And I think outcomes is another word that we should hang on to. So, next one is about the child's journey, and this is one of the key principles that was outlined at the start of the Back to Basics review. So the child's journey, as set out in the Monroe Review, should be a driver for change. So children should experience a seamless pathway of intervention as they transition across into and out of services. And entry and exit from specialist services too should be effortless. Now that's quite a challenge. And our interventions, again as been said earlier today, must be child-centred and always focused on outcomes. So when we look at this lovely little person on the bike, we can see a few important factors here. We want the journeys to be safe, we want them to be stable, some nice stabilisers there, but also happy ones, reflecting on what our young people have fed back to us. So the review. These are just some of the points about the importance of the review. So we decided that we'd review the way agencies and families work together and look particularly at the identification of gaps and challenges within our current processes. And I think you'll hear that we really have listened to professionals, to families, very much so, and gained a good understanding of some of the difficulties and those professional pinch points. And as you would expect, we developed an action plan to support change, which the Safeguarding Board has monitored, both through the partnership subgroup, but also we've reported back to the main board. And we've done a lot of consultation. We've also scoped and looked at what other local authorities are doing. We've taken into account serious case review findings. We've looked at accountability, and we respond very much to practitioners' thoughts. The consultation targeted professionals through the online survey, and I would imagine, hope that everybody here today was involved in this, and we had 570 responses, and parents and carers too were consulted, and 410 responses came in. So that's quite considerable, and it really did provide us with a richness of both quantitative but also qualitative data. And the findings and the evidence base told us about some of the top challenges, and these are things that you would probably expect. That we heard about time constraints and capacity issues, funding and lack of resources and or staff. An important one is the one around knowing where to go for support, what's available, and getting access to these services, and then engaging families, and finally that experience of lengthy processes sometimes and long waiting times for certain types of service. The family feedback was again illuminating. Many didn't feel there was a good relationship with the practitioner, or felt that the practitioner didn't understand the needs of the family and child, and sometimes they felt their inquiries had not been followed up. They weren't referred always to the appropriate service, and we mentioned waiting too long. Sometimes they felt they weren't listened to or taken seriously, and again that lack of information. So important family feedback there. And this is a very important slide, because this is the "you said, we did it." So 40%, as you'll see, wanted more relevant systems and paperwork. They wanted things simplifying, which again is the message from Monroe and from Sue this morning. So we've moved away from the CAF in terms of developing the new systems into the new early help assessment framework, and you'll hear more about that from my colleagues in a moment. 28% wanted support with administration and local coordination and sharing meetings. And so we are improving admin support for agencies who are working with complex cases at that early help level. 21% wanted additional training, so a new training framework is coming along. And 11% wanted locally based support attended to. And this is about refocusing our multi-agency teams, but also bringing in some new early help advisors who are qualified social workers who will be accessible through on a geographical basis, but they'll be accessible through our early help systems in order to just provide that consultation, that ability to check out if people are uncertain about whether they're doing the right thing. And then finally, other better agency support and attendance. That's about the involvement of agencies in meetings such as child protection conferences, and we're really promoting better accountability and governance. So that's my simple introduction. We're now going to hear from my colleagues down here, you'll hear are from different agencies, and they're going to speak about the new offer, what's the difference, what difference it will make to children and their families. So I will now hand over to Jackie, and Jackie will introduce herself properly.
Hello, I'm Jackie Poynton. My job title is Clinical Service Manager, brackets, children, close brackets. I look after CAMS, CAMS-LD, community paediatrics and community children's nurses for the Shropshire Community Health NHS Trust. Got that? Well, I'm going to try really hard to keep within the 10 minutes. I'm also going to try really hard to keep with my script, which I've scribbled all over. But I can't help it. The first thing that occurs to me when I think about what do we mean by early help, I need to press a button. So I was going, what am I doing? That one. There you go, that's what I'm talking about. That's what I'm talking about. So, first thing I think when I think about this one is the word resilience. And I've decided that we should have a theme tune, and it should be Chumbawamba. I get knocked down, but I get up again. It's just so relevant, because we all get knocked down, and we need the help in getting back up again. And the resilience is about the difference between being able to get back up again or not. You with me? Yeah. The journey has been as important as the destination in terms of the Back to Basics review. It's been brilliant because it meant all the agencies have been together and coming up with these solutions, which is what this has all been about. It's not been about creating new process diagrams. It's been about, well, what we're going to do about it all. There. So, the Shropshire Early Help Offer. Our offer is not about taking away agency accountability, but it's about giving practitioners the support, training, tools and confidence to help them make better sense of the needs of the children and families they work with, and get the right support to those families at the right time to prevent problems escalating. That's kind of the definition of early help. Linking it in with Sue's presentation, the bit she talked about was the meaningful dialogue and quality assurance. That's how I've interpreted it. It's not about necessarily multi-agency meeting for the sake of it or getting people together for the sake of it. It's about that meaningful dialogue, because that turns into your organisational learning. The stuff that you take away from those conversations. Sally and I were talking about something similar earlier. In your pack as well, you'll see there's the support pathway. We're just waving at this so you know what I'm talking about. And that's exactly what it is, a support pathway. It's a way that people working with children and young people can get support at each stage. It's about making sure that right from the beginning, you've got somebody to get support from. I'm not going to talk about each of the different bits on that, My next slide is the, wait a minute, early help advisor. That's what I'm talking about now. I'm not going to talk about the first point because Simon's going to talk about that. But the early help advisors, and these are the ones that Eileen Munro talked about, having senior social workers who are very confident and competent and credible, being able to offer consultation, advice and guidance to people working with children and young people. I see lots of people nodding, so that's hitting the spot, excellent. And that's what Shropshire's done. Shropshire's recruited, or finished recruiting, yeah, to these, so what they will be are exactly that, senior social workers. They will operate as supporting in an advisory and consulting role. It's not about doing, it's not about getting into the families, it's about supporting the professionals working with those families. But they're about offering credible, meaningful advice at the time you need it. They'll assist in the quality assurance programme. Sue talked a lot about that, didn't she, about quality assuring what it is we do, not just doing more of the same stuff or clinging on to evidence base. It's about actually quality assurance. Have you tried this? Did it work? Better, worse? I'm actually keeping a tab on all that process. The other bit that the early help advisor can do is help you expedite where escalation is needed. So when young people actually are in trouble, when families are in trouble and you need to escalate up through, and again looking at the support diagram, there's the red bit, which as you can imagine is when things have got really complicated. So that's part of their role, is to help move that forward. As well as the other way, in de-escalating, so bringing things down to lower levels, so back to early help. They'll be helping to look at the family partnership meetings, questioning why cases are getting stuck, help identify who else is involved, or if we need to refer to the early help panel. Somebody else talk about the early help panel, or should I talk about that a little bit? You're going to talk about that, I'll shut up then. Right. Don't want to tread on your toes. Okay. And of course, because they're senior social workers, they'll have knowledge about what's available, so they'll really understand all the agencies that are working with young people and families. And the early help advisor's role will evolve as we move forward, because of course it's a new thing, and the whole point is about the feedback loop again that Sue talked about. What's working well, do we need to do more of it? What's not working so well, can we reshape that and make it more meaningful? And I guess the bit that I've written on the bottom, thinking about Chumbawamba, which is really stuck in my head now, is that practitioners need resilience too, because it's not just the families and the children that get knocked over and need to get up again. It's the practitioners. You know, that idea about sometimes when they mess up or when they get stuck, you know, it's not always about doing things wrong, but you just don't know what to do. You need the resilience. I need the resilience as a practitioner to be able to figure out what it is I can do differently and to be able to do that next time with another family. And that's what all this, the early help advisory, the early help panel that Sarah's going to talk about. Okay, I've got lots of words on this one. I'm not going to talk about all of the bits on this. There's the parenting support programme and TAMS and communication are the three bits that I'm going to focus on. The other bits will be picked up by other people. So just to talk a little bit about parenting, the model that Shropshire's looking at is the Solihull model, which again is, rather than it being about an evidence-based programme, is much more about a way of working, a way of thinking, a way of being as a multi-agency community and alongside families and parents. So what that means is that there's going to be an extension of the parenting support programme by delivering parenting workshops and groups, ensuring that they're accessible to all parents and carers across Shropshire at all levels of need. Providing training to all practitioners working with families to develop their knowledge and skills around child development, child behaviour, parenting behaviour, and skills to enable practitioners to incorporate parenting support into their everyday practice. It's really key. You can't talk about parenting in an abstract context. It has to be part of what you do every time you meet with somebody. In health, we call that making every contact count or something, don't we? In health promotion. Same kind of theory. So the adoption of the Solihull Parenting Programme is a core programme for professionals working with children and young people, meaning that there will be one-to-one and group provision across all levels of need. So by the beginning of 2013, there should be 12 multi-agency trainers who will be able to deliver foundation training to teams across the local authority, empowering other professionals to deliver the parenting support as part of their daily work as well. By offering parenting support, and this goes back to what we were saying before about it being something that you can't do in an abstract way, as a broad-based, non-stigmatising and universally available package, the aim is to improve the support to families who've been less ready to access traditional services for all the reasons we know and understand. And it's about developing a common language amongst the professionals, and that's the kind of thing we get better at when we sit in rooms together and actually have conversations with each other. So that parents who receive input from multiple agencies are going to get a coherent message. Because part of the difficulty now is they might hear one thing from a social worker and one thing from CAMS and one thing from a teacher, and it's conflicting and they get muddled and confused. So how can we make that more coherent for families who are using our services? Switching to TAMS. Helen Bailey's in the room. There she is in pink. Say hi. She's TAMS. Targeted mental health in schools is what TAMS stands for, if you don't know. And the fundamental purpose of TAMS is to embrace everyone's business approach across Shropshire in the prevention of mental ill health. Through the promotion of emotional well-being to children and young people, families and professionals using strategies which promote confidence and resilience, there we go again, to motivate and inspire them to be the best they can be and to be able to develop positive coping strategies to manage difficulties they may experience now and in the future. And that's the first level bit, which is the bit that every child should be able to access, that level. If you're thinking about what the young people said in that video earlier about what they want, that one very bright young man said about mental health being something very significant and separate that needs a particular way of thinking about it. And in order to achieve all those other things, that's a really important bit, their emotional well-being and their mental health. TAMS also provides multi-agency training to pastoral and specialist staff who work within schools. And there are particular programmes, targeted interventions, so this is the second tier of TAMS, when you're picking out the young people who really need some targeted interventions, the ones who might have emotional, social or behavioural difficulties, which is impacting on their ability to engage with other young people or with their teachers, and therefore their ability to learn. Examples of the targeted interventions are Reach for the Top, a one-to-one intervention to build resilience, confidence, and that's based on attachment theory principles. Seasons for Growth, which is an 8-week peer support programme that runs around bereavement and loss, a whole range of things from death to a friend moving away or family separation. And the Self-Esteem Garden, which is an 8-week peer support programme to build confidence and identify who and what prevents growth. Friends for Life, which is an 8-week peer support programme based on the principles of cognitive behaviour therapy to help manage anxious pupils to manage that more effectively. So lastly, I'm going to talk about communication. Part of the early help offer is having a one-stop shop for information. So a communication aid which keeps the right people informed of service modifications, updates, training courses, available services and performance information, access to tools and with evidence of best practice, all available at the right time in the right format for the professional. So it's that pigeon and rat thing again, isn't it? The right thing for the right person. And there's a website that's been developed to meet that need. And we know how important that is because our services are changing quite frequently and it's hard to keep track. Just with regard to information, 58% of parents and carers asked said that they'd not been aware of the Family Information Service, and that's probably one of our best resources locally. The Family Information Service is going to be more present and available for support and signposting across the whole pathway on that support diagram. And I think everyone would agree that if you wait for issues to become too severe, you've missed the opportunity to intervene early. And we talked about this thing about intervening, but it's about getting in early enough so that you can stop things escalating. And that's the fundamental principle behind the early health offer. And I'll now hand over to Sarah.
Thank you. I can find out how to move this on now. easy. Okay, there's no words on my slide. I've got 2 slides to cover. This one talking about early help and resource panel, and the second one which is about engaging young people and their families. I've got 10 minutes and I do need to keep an eye on the time, because as you prepare for these things and then you go through the day, you think more and more and make more and more connections. I am no expert on the early help and resource panel at all, but I'm delighted to have been asked to talk about this this part of early help, partly because within my service area we have an early help and resource panel for under 5s. Just to backtrack, I am Sarah Wilkins, and I'm a service manager for Shropshire Council, and my service is called Family Care and Wellbeing, and within that I'm very fortunate to work with colleagues who deliver children's centre services and work with the community and partners to do that, targeting mental health in schools, the parenting strategy, funding for disadvantaged 2-year-olds, which was mentioned earlier, and the teenage pregnancy strategy and all the things that come within that. So it's great to be here to be able to talk about some of the things that we do and try and explain a bit about what the Early Help and Resource Panel intends to do, and that is part of Early Help and the framework that's within your pack. And when I was trying to think about what it is, it's almost like when you think about the child's journey, it's an opportunity for professionals to really get some confidence and to be part of a learning culture, I think, by having, I don't know, it's a bit like a service station, if you like, on a journey, an opportunity to have a professional dialogue with others and to look at the best way forward, and particularly in this time of reducing resources, to ensure that the resources are most effectively targeted. So, there is a plan for an early help and resource panel to develop. It needs to align with the early help and resource panel that exists now for the youngest children, and that we don't know what that will look like exactly, whether it will be 1 or 2. There's important principles behind that, which I'll talk about in a moment, and then I'll talk a little bit about what our resource panel currently looks like and what we've learned from it. But if there's anything that I want to get across, I think, in the few minutes that I've got, is that the Early Help and Resource Panel isn't so much about the process and the way that it will work, but more about the fact that it is about the creation of a learning culture, and it is about that opportunity to develop the relationships. And we've heard that lots of times already today. My experience of that is that that's exactly what it does. The expectation is that the Early Help and Resource Panel will be prototyped with 3 providers that are currently sitting as a provider panel, and those include, and I'm going to Bernardo's, Divert, and I'm looking at Sophie, Targeted Youth Support, thank you, sorry, I needed prompting there. What is it? It's about peer consultation. It's about identifying the right resource to target, and there's an expectation that the early help advisors that Jackie's just referred to will be able to bring along those practitioners that are working with to the early help and resource panel as a way of consulting. I think what we've got to be very clear about and underline some of the assumptions and drivers there, that there is an expectation that this is not a panel that manages risk. That has to be done in parallel. So you're not handing that risk over, you're not expecting somebody else to do that by passing something on. It's about that opportunity to check and balance and to have that professional dialogue. The expectation is that assessments will be complete by the time they come to a resource panel. There's a quality assurance element of that, and I'll reflect on that in a minute from our experience. That accountability is evident and transparent through the fact that managers will have been consulted in advance of that attendance coming to a panel. And I think, again, around accountability and that demonstration of a learning culture is that there will be the opportunity to have a consultation around the understanding of the right intervention and make a choice following that. So there's some quite clear principles behind it.
I said this isn't about, the panel doesn't expect to manage risk, that happens, those thresholds exist and they need to be managed in parallel. And we mustn't take that away from organisations and practitioners, because that responsibility and levels of accountability are essential to be retained. So the panel isn't there to hand things over to somebody else to make a decision or to provide a resource. Okay, what I want to move on with really is to talk about the experience that we have, because I can't tell you any more about something that isn't actually happening as in its names at the moment, but will happen. Within children's centres, we developed something that has turned into an early health and resource panel in relation to our casework as a way of really managing demand down to a degree. We were faced a year ago with significant waiting lists in relation to casework, which presents all of us, but I have to take responsibility for, with a risk issue. So what did we do? We looked at how we audited those cases that were waiting allocation. We talked to professionals and partners, and in conjunction with our health visitor colleagues, and models that they were wanting to implement in relation to the increase of health visitors and health visitor implementation plan, was to come together in a form of panel. Now that's been evolving really since January 2012. We set it up in the Shrewsbury area and now operates in North and South. What does it do? It's a meeting for sharing information. Now, what I will stress, albeit that we were given food for thought this morning around the importance of information sharing and recording, that is important, but it mustn't restrict us from doing what we need to do. This meeting, which happens on a monthly basis, this panel is underpinned by a very clear terms of reference and a protocol of information sharing which I'm confident is rigorous and is reviewed on a very regular basis. And I'm really lucky to be able to stand here today and say yesterday I was in Oswestry with the panel there, just by matter of course of reviewing these things, and we have no team manager, so I'm sort of doing that job as well at the moment. So I sat to do some of the monitoring, see how it was going. And the behaviour there that was demonstrated is very clearly saying that the members sitting on that panel, which are health visitor colleagues, children's centre manager colleagues, social work colleagues, are clearly committed to terms of reference, to their attendance, to the commitment and the learning environment. What does that panel do? It identifies need and targets resource for those children that are the youngest children. It's working with children that are under 5, albeit that very often children that are over 5 within families benefit too. It improves our assessment skills and our understanding of need, and it has provided a swift response. All of these can be evidenced. Seemingly, the resource panel seems to be making more sense for families. That's the message that we're getting back from families. We had some clear feedback from families coming from the Back to Basics review, which I'll talk about in a minute. It is providing us with some evidence of more cost-effective services, and it informs service delivery. So out of that, where we're looking at cases together, actually we may be targeting a resource differently, and that resource is more cost-effective. Very often we found in our audit of our Shrewsbury cases that where we've got professionals asking us to open families to casework, that actually we could support those families through group work, which through our unit costing, which we do, actually just demonstrate a more cost-effective service and builds capacity and peer support for families. Just as a very quick example, and somebody tell me if I'm beginning to run over, Sophie will. In Oswestry yesterday, what happened? We went through a number of cases. We've got colleagues in this room. I know Tina and Alex are here, and Elaine Goff was here earlier. She's still here. Yeah, she's still here. That we looked at, we probably looked at, I don't know, it seemed like quite a lot of cases, 15 at least. What happened, what was the experience of yesterday? In one case, an assessment was reviewed and went back to another professional to have that conversation about the quality of that assessment and the information that was on there. What else was was what has happened as a result of one of the cases being discussed there. A 2-year-old place was identified for a child, and the role of the Children's Centre support worker was really honed in terms of what they needed to do to ensure that that child would access that place. And I think one of the other things that I've pulled out, and there are many more I could talk for longer, was a case demonstrating, I think somebody said earlier about thresholds changing. Families' circumstances change and can change very, very quickly. Social worker accountability was brought to the table, and the social worker was going to go back and have a conversation with managers. You standing there, Donna, because I'm running over. 2 minutes. I can talk about this all afternoon because it is really very interesting. Anyway, I'm going to move on. So that is early help. We've got some very good examples coming out of what we do with the under fives, and hopefully we will have some shared learning coming with the other panel as it develops. I was also asked to talk about engaging young people and their families. You know, the peer review raised that Back to Basics has raised lots of feedback from families. And essentially, you know, what we need to do around continuing to engage young people and their families is about affecting positive change and sustaining it for the best outcomes. You know, families need to be able to make informed decisions and informed choices and to support one another. The benefits of that reduce costs, and you know, I say that from a service manager perspective and can see it happening and develop capacity where it counts. You know, the review, and I won't go through all this, you can look back through the slides, the review told us a lot of things that families said. I think in terms of engaging young people and their families, there's a lot of very, very good work that's gone on, and I'm very fortunate to be able to reflect on some of the work within the service that I lead, you know, around work with chat, confidential help and advice for teenagers. The TAMS work engages young people and families really well. Respect yourself in terms of the relationships and sex education work, and young people being involved in the development of the Children and People strategy. There's some very good examples out there, but we mustn't get stuck in seeing it as part of the process. We must look at the quality of the conversation. And be brave, I think, about some of the conversations that we have. And again, you know, I am very, very fortunate to be able to work with colleagues who do such amazing work with families and thankfully tell me about it. You know, example of that, one of the Children's Centre managers gave me the other day is where they'd worked with a family through a child protection plan and actually had to really raise some significant concerns where a parent was seen to hit their child within one of our groups, to raise that, to challenge that, to go through the child protection process, to go through that planning process, but to come out the other end and to evaluate that work with a parent who, as the manager said, she'll be back. You know, that this hasn't affected enough change to make to move her away or move the children away entirely from the threshold. However, that parent, through the evaluation, was able to demonstrate how some change had been affected and there were some things that would stay with her. So we can't make massive changes overnight, but you do need to keep having those quality conversations. I think through doing this work and continuing to really ask what is it that we're listening for, and what are we hearing from families and from children in particular. There is that opportunity to increase peer support with families. I think we're starting to do a good job with that. There is the opportunity to manage the demand down, which is the significant public service driver. And we've seen a lot of our individual casework now moving into group-based work, and what's very exciting is where families, and we do have these examples with the under fives, families are starting to develop their own peer support networks. I could just go on and on, but I'm not going to. I'm going to finish and hand over to Simon. Thank you.
My name is Simon Dean. I'm a Staff Development Officer covering children's social care. I work in the Safeguarding Group, and I've helped support training development for the Shropshire Safeguarding Children's Board. I can't quite remember when I got drawn into the process of looking at the early help assessment form, but it's been a very interesting and at times really quite challenging piece of work that has come out of the Back to Basics review. Has come out of listening to a lot of people. One of the things that really encouraged me to get on board was the open-mindedness of the review, really, the desire to hear what it was that people had to say about what we were doing and how we might be able to do that differently. And obviously that was very much reflected in some of the processes that we already had in place. Some of those processes that were working well, but some of those processes that seemed to be providing challenges to the families that we were working with, to some of the professionals that we were working with. And we needed to rethink about how to make that feel more family friendly and more professional friendly. So we had to look at what it was that wasn't going right, but not throw out the baby with the bathwater as well. And I was fortunate because social care has been so influenced by the Munro Review to hear a talk at Birmingham University that looked and challenged us about some of the processes and systems that we put in place and really asked the questions as to whether those processes were really good for the people that we're working with or whether they were good for the organisations that were adopting those processes. So with some of those things in mind, that was the approach that we wanted to take when we were looking at the early help assessment form, to come up with a form that felt more friendly and accessible to families, and a form that sort of allowed professionals to do their job and to do their role more effectively. We've got some agencies who are very confident in assessing. That was very much part of their task, very much part of their focus, and they would make whatever form it was work for them. But we also had some agencies who were saying, look, I just don't understand this, it's not my role to do this, and yet they're really, really important players in supporting families. They're working with families, whether that's directly or indirectly, and we needed those agencies to be very much on board. So we've had a lot of discussions with people about this. What we really wanted to do was develop people's professional confidence and competence when it came to working in the safeguarding arena. Most professionals are clear when child protection kicks in, but they weren't as clear of their roles sometimes in the prevention work that goes on. And we understand that quite often people have focused areas of work, they're employed in a specific role. But we all, in the role that we do, care about the children that we work with. And we want to help organisations feel more confident about responding when children have additional needs. Because we know it affects them, whatever the focus of our work is. If those children are in home environments that feel threatening or unsettled, it's very hard for them to give it their best in the environment that we're working with. So what we try to do in the form is to encourage professional thoughtfulness, really. When it comes to assessment, you can gather lots of information about a child or about their family, but it's about the sense that you begin to make of that information, because children are different and families are different. So the focus that we've taken on the form really is allowing a professional conversation to take place in the mind, really. Knowing what I know of this family, knowing about the information that I've gathered here, what sense do I make of this child's experience? What is it that's causing me concern here? What are the strengths of this young person or the family environment they're in? Because again, if we only focus on what's not going right in the sort of prevention agenda, we're not really going to begin to build an environment of sustainable change, because actually families need to be able to own those agendas for themselves, to develop their own confidence to be able to deal with issues when they arise. If it's always about professionals doing things to them, then when professionals withdraw, then families very often will default back to the patterns and the behaviours that seem most familiar to them. So we wanted to build into that some idea of encouraging professionals to identify what's working well in that environment. Now sometimes that may be quite challenging, but actually, it's really important for families to know that it isn't just about what's going wrong all the time. And for young people also to be able to see a future, to be able to see where they might like to be in 3 or 4 years' time and how they might get there. So a sort of strengths-based approach built into that thinking. To build into the form is the idea of identifying strengths as well. So we want people to begin to hold those two elements in tension really in that. What is it that's concerning me? What is it that's going okay in this environment? What can we shore up? What can we develop? What can we build? What do we need to address really? One thing we discovered very much, the more we consulted, and originally we started by trying to tweak the existing common assessment framework sort of format. The more we tweaked, the more we kept on tweaking. Because there's no one size fits all. You know, there's in the same as our families, the young people we work with are differently, professional processes are differently. And so the other thing that we've tried to do in the form is to minimise, in some ways, the overlap between professional processes and what feels meaningful to us, the things that we do, and actually what feels helpful to families. So if you're using something, and it works well for you, and it works well for your agency, we're not saying that you can't continue to use that. Do use what works, but the form itself will then drive you through a decision-making process, having used whatever format that works for you, about, so what does it mean for this child? What does it mean for this family? You know, what do we think the main issues are here? How do we plan for change or to make things differently? What sort of services might we need in that environment? I mentioned at the beginning just in terms of professional confidence in that. And I think sometimes we protect our professional identity by holding those things that we do well quite close to our organisation. And we want to really encourage a sort of learning culture. So we're looking at a number of tools that support areas of practice. There's already a number that are released by the Safeguarding Board, whether you look at neglect, whether you look at sexual exploitation, whether you look at suicide prevention. But there are lots of other different tools out there because, you know, where if people aren't so confident, you know, we want to help you to think about what it is that you might need to find out, what it is that you might need to think about when you've got concerns about a family, so that you can begin to draw the evidence that you need into your assessments. And when it is that you're seeking additional support, and Sarah's alluded to this, it's really important that we've got the information that we need. So you will be challenged about it in a nice way, but it's not just enough to tick a box and say referral here. It's about why. Why do you think this young person needs service? Where is your evidence for this? You know, to make sure that that family gets the right type of service from us. So sat alongside the form will be a number of tools that will help support you in the work that you're doing. Really important for us to develop a learning culture. There's excellent bits of practice going on right across the county we often never hear about. We want people to share about what it works, and it goes back to that element of professional thoughtfulness. You know, is it working? Why is it working? Do we know why it's working? We may not know why it's working. That engagement with the family is really important because they might have their own ideas about this. That conversation that says, where we've had change, why did we get change? What was significant for you? What really made a difference for you? Because what we think brought about change might not be always the reality of that, and it's really important to capture the family voices. But we also want to build in the thinking about why isn't it working? And Sue White alluded to this, that sometimes we may be going down the wrong track. To encourage professionals to stop, think about what they're doing. It's not working, why isn't it working? Is there something that I've missed? Is there something else that I need to think about in terms of that? And finally, we're going to be building that very much into our training sort of framework and the approach that we want to take about training. So, although we'll be telling you about processes, because you need to understand about processes, we're going to be focusing much more on your skill development and building that into your training so that you come away feeling more confident about the families that you're working with and the ways that you're going to work them. I've had the nod. I shall pass on to Angela now.
Hello everybody, I'm Angela Bithell, I'm assistant head teacher at Sundawn Secondary School and Sports College in Sundawn, which is very close to here in Shrewsbury. And I want to ask you a question first. Why are you here? Because I asked myself that. because I'm here because my darling assistant head teacher said to me one Friday evening, late, I've had 2 glasses of wine, so he knows when to catch me on a Friday. He said, I need somebody, a secondary representative, to join this steering group, this called Back to Basics group. Nobody else wants to do it, will you do it? Remember, I'd had 2 glasses of wine. So I said yes, but I'm glad I said yes, okay? Because this, I feel, is an opportunity for me to speak on behalf of education, and it is a way of making a difference, a real difference. Every single day, I see families and children whose systems are failing them. Absolutely every day. Okay? Yet yesterday, when I was writing it, I was thinking, I'm really scared. I don't want to do this. What on earth am I going to talk about? I'm going to speak from the heart, folks, because that's what I'm about. Okay? Yesterday morning, got to school bright and early, as always. I sorted a child out who was riddled with nits and needed a pair of glasses because she couldn't read. Okay? I don't bother. I spoke to a child who was in the child protection arena, who was physically sick in front of me because he couldn't cope with coming to school that morning because of all the things that were happening to him. Okay? I spoke to another child who was in equally difficult situations. And it was only 10 o'clock, and I taught as well. And I was managing my staff as well. There was a child sick in my office. There's a girl full of head lice who hasn't got glasses to read. Her parents can't read and write. It's not an easy conversation to have on a Monday morning. So every single day I'm there seeing that. And I know you are as well. And I am an ordinary teacher, and I'm proud of that. But for you colleagues up there, I'm a foster carer as well. And I've been a carer, and it's really tough. I've left care homes saturated in eggs, flour, makeup, lemonade. I got home at 3 o'clock in the morning. It's really tough what you people do out there. And it's really tough in schools. It's the toughest it's ever been. I've been doing this job for 14 years. It's really tough. You know, I'm physically exhausted, I'm sure many of you are every day. And why are we here? Because we want to do our job well, don't we? We want to do our job well. We chose this profession because we care, and we want to do our jobs well, and that's why I'm here. I'm really scared, you can probably tell, but I want to say it because it needs to be heard. Okay? So I thought to myself, why have I been asked here? Sophie's asked me, I said, no, I can't do that. She says, yes, you can, everybody says you can. And so I said, all right then, and I'm here. Okay? And I thought, well, why are you asking me? I'm just an ordinary teacher, I just teach children. I'm just a cog in a wheel. I'm not just a cog in a wheel. I make things happen. My colleagues make things happen every day. And I'm really proud of that. I'm really proud of our school. I'm proud of our community. It's absolutely fantastic. That little cog spins a big wheel which makes a difference to lots of people. A huge amount of people. And all you people are doing that in some way. And we should be proud of what we're doing, and we can do it. Okay? Education has changed so much. So much. And yes, we've thrown all these things, Ofsted frameworks, all the rest of it. Yes, they're really important. But at the end of the day, education is there to teach children to read, to write, to enjoy, to achieve. I was taught with the 3 R's. I'm sure many of you were taught the 3 R's. Okay, we all know that term and expression, don't we, the 3 R's. Education isn't about that anymore. I think it's about the 3 E's now. Education. Emotionally healthy children. In this society, doesn't matter if you do need your 3 R's. Yes, of course you need them. They're vitally important. It's the only way you're going to achieve. But you've got to be educated well, you've got to be emotionally stable and resilient, and you've got to be employable to give back to this society. If we can't give our children that, we're not doing our jobs properly. That's how I feel. Okay, so it's about the 3 E's as well, and I think we need to maybe think about that. So, what's happening in our schools? Well, I think the Back to Basics review has maybe given us the opportunity, and I hope it has given us the opportunity, it's certainly given me food for thought, to think about what difference that we can make in schools for our children, for our families and our communities. And that's what I'm going to quickly go through with you. So for our schools, it does give us opportunities to raise our academic results. Yes, you do have to have data to prove all this. I know that's what the lady said, that wonderful professor said this morning. But it does improve results. Our school is testament to that. We were not doing well 5-6 years ago. We have changed a lot of our systems. I don't care what anybody says, it's because our staff care. And they go that extra mile. It's not about all what they're teaching, they're still teachers, it's because they care. And if children aren't learning, they can be withdrawn out of groups in a less disruptive environment, and they're really hard to reach students who are really struggling to maybe read and write can be taught separately, okay? Which allows our teachers to educate the children in the classroom and do their job properly. It may improve Ofsted, because this morning it was said, what I said want to know is, so what? What are you doing? Okay, but we don't know that, but we've got tools like PASS to help us prove that those things, which I think are very useful. I know people in education will have burning questions about the pupil premium, and I want to make this very clear. National radio and TV announced last week that the pupil premium, which is the money that's allocated per pupil in the schools, there's a lump sum for every child. It is not a lump sum for every child. It's now a lump sum that a school gets to use that money to do what they want to do to make it work in their school. The pupil premium does give some flexibility now, because head teachers can make a choice about what their school really needs. Okay? We have a problem at the moment in our year 8. We've got quite a few racist issues. We're not happy about it, we're very worried about it. I'm using some of that pupil premium money to deliver a workshop from the police to really focus on those students. Okay? We've got a real handful of difficult boys who don't know how to control their emotions. They're really let down by systems. Half of those pupils I just mentioned are under a child protection plan. Got massive anger issues. Is there any wonder? Okay? So we're using that pupil premium money to organise some anger management sessions for those students. It doesn't end in 6 weeks, 12 weeks, 3 months. It will end when the pupil says they don't need it anymore. Okay? We can use that pupil premium money a little bit more flexibly. It should mean in schools also that staff relationships with the safeguarding board has improved. I know already mine have. I've met some wonderful people, and I know we all want the same outcomes. It should give a clearer pathway with a more structured two-way communication system. And also, the Early Help and Resource Panel should give us the opportunity to seek professional advice for those pupils that are really stuck, and the staff that are stuck. I'm stuck all the time. I need unsticking. We all need unsticking, don't we? So that's hopefully how schools can use that panel. To our students. Well, of course, we teach 11 to 16-year-olds in secondary school. Very adolescent, very difficult, Kevin and Perry's. I'm sure some of you know what I'm talking about. General expression I hear at most houses, bothered, whatever. Okay, what does that mean? It means I am bothered, and whatever happens, I want you to be bothered as well. That's what it means. It doesn't mean whatever, it means help me. That's what we're working with. Students only use that language because they don't know any different. They don't know what to do. They're stuck. Okay? So it should mean our pupils should be happier. They should be more confident. The adults know what they are doing through training. And they should know that they've got an opportunity to speak up and have a voice. Because, of course, teenagers are never listened to, are they? Okay? They should be more successful because they can concentrate on their own learning. They should be more confident because the adults and the agencies are doing the worrying for them and the problem solving for them, and they're allowed to be children again. They should be less isolated because we can normalise, perhaps we can normalise what is happening for them. For our families and our communities. The family unit is the most important thing that you can offer anybody in life. It provides love and opportunities. If you've got a good family is working with you, it should provide confidence. Because they'll have the strategies to learn to parent properly, to cope, to manage their feelings. Being a parent is the hardest job in the world. Absolutely, I didn't realise how hard it is. It hits you in between the eyes. It's tough. It should give families less crisis management and less anxiety because they will have more faith in the system, and it should be easier to achieve small steps. Perhaps they won't feel let down anymore. Perhaps there'll be less waiting time. How long do they have to wait? Correct and swift referrals, better communication and trust. And for our communities, Sunderland is a wonderful community. It should provide an improved community cohesion where we're working together due to less stress and less anger. Less anger. We should have less isolated families because they should have gained the coping strategies that the parenting programmes have given them, opportunities and doors that have been opened. We should have less visible poverty. There is real deprivation. We have children that do not have shoes in this day and age. How can that be in this society? We've got children with teeth that are falling out, with no shoes, who can't read and write. The system is failing them. Something is wrong. And I'm really grateful to youth service. I think you do an absolute tremendous job. Those people are vital. People on the ground floor, those care workers that are there every day having lemonade thrown in their face, doing pin down. How nice is that, doing pin down every hour? It's hard, physical, exhaustive, unrewarding, relentless work. The youth workers are absolutely fantastic. And I know the CSOs, community support officers and the police are absolutely there to support us as well. We want to have pride in our community. I'm proud of Sunderland. We want to see less graffiti and vandalism. And that will give families, communities, more time to do things in life that we should be doing. Less worrying and enjoy our lives a bit better. Thank you.
I get the really exciting stuff to talk about. Offset inspections. Right. I think, yeah, just a real quick whistle-stop tour. Just for some of you, in case you don't know me, I'm Steve Ladd. I'm the Safeguarding Board Business Manager, but I'm also Service Specialist for Safeguarding for Shropshire Council Children. And just sort of listening to the way that the days unfolded today, I think just sort of brings me back to a moment to think about actually those questions that keep coming up, which is why are we here? Why are we doing what we're doing? And clearly what people, certainly after the very heartfelt presentation that we've just heard, the children are very much at the centre of this process and very much at the centre of the work that we do. And I think that's a really encouraging notion to be hearing today when there's a group of such varied and different practitioners present here today. The Back to Basics review and the offer of early help, which is coming out of that Back to Basics review, I think we just need to pause and think about this a minute. This is probably one of the most significant "you said we did" moments that Shropshire as an authority has experienced for quite a many number of years. Not just from the practitioner's perspective, frontline practitioners, managers and others, but also from children, young people and families. And I do think we need to pause and think about that, because actually the kind of conversations that Sue was having earlier today in her presentation, actually this response that Shropshire as a local area has developed and worked to has been really quite bold, quite brave, and is going to lead to some innovative practice. So I think it's worth people sort of listening to that. And I'm very excited to hear about the developments that have happened with the early health advisors, because I think that will also make a significant improvement in the way that we communicate and the stickability of some of that information sharing, for example, that might take place. Anyway, back to what I was going to talk about, which was Ofsted and inspections. As has already been sort of alluded to through the course of today, we're currently sitting within an interim arrangement, which people will be familiar with, or may become more familiar with. Previously, we had 2 weeks, in essence, notice. Inspections going to take place. We busily prepare all of the information that we need to do and present a nice package, in a sense, to the Ofsted inspectors who come along around. This is what we do about safeguarding in Shropshire. The interim arrangements that are in place currently it's unannounced. Okay? The final report back in May 2011 in relation to Professor Munro's review of child protection systems in England emphasised the continuing importance of that independent scrutiny of the child protection system. And it made a number of key recommendations which we see reflected in the interim arrangements for inspection of services that provide safeguarding arrangements, but also what's coming over the horizon. As I said, inspections are unannounced, and part of the reason for that is to minimise the bureaucratic burden. The inspection framework, and this is important, it examines the effectiveness of the contribution of all local services to the safeguarding arrangements for children. So it's not just about how well social care, if you like, works with others and what they do and how they go about doing what they need to, but it's also about how others really are behaving, fulfilling their responsibilities in offering help to children, young people and their families along their road into services. And it very much puts the experience of the child in terms of the child's journey at the heart of the inspection framework. So, you know, as it says, it sort of brings back that sort of agency accountability, not one agency, but actually agencies on a local basis. What services are you providing to attend to the needs of the children and young people that come into contact with you and who need help? Okay. Really interestingly, in April 2013, to take this a step further, there will be a multi-inspectorate regime that's in place, which brings together Ofsted, CQC, HMI Inspectorate for Probation, Constabulary, Crown Prosecution Service, variety of, I'm trying to remember if I've missed one and I hope I haven't, but many of them anyway. And really that's a reflection, I guess, of kind of the onus that's being taken around the arrangements that need to be in place to provide help and protection for children and young people that we'll come into contact with on a multi-agency basis. I think it's really interesting that the 2-week unannounced arrangement remains in place, and there are some different elements in the methodology being approached by the inspection, which is going to be this so what question. It's the tracking of the child's journey throughout the process of being identified as needing some additional assistance or support, through to accessing acute services, high-end services, which may be about becoming a looked after child, entering the child protection system, etc. But we'll be looking at all contributions to that process. And we'll look at critically reviewing what difference did it make? So what? You've escalated it, you've moved in this direction, but what difference did you make, and how are you evidencing that? And more importantly, what does the child, young person or family think about what difference you made? As I said, it's an inspection of local arrangements, and there's kind of 4 key judgments that are being looked at as part of the process, which is about overall effectiveness of multi-agency work, the effectiveness of help and protection in terms of identification and the early offers, the quality of practice, and also looking at the sort of leadership, governance and partnership. And I think if we think about the Back to Basics review and the commissioning that took place by the Safeguarding Board, there's a really clear driver in terms of governance, in terms of what does the local area need, how are we going to flex and respond to that. And there's been a significant amount of work that's taken place leading up to this. And just the idea of the sort of number of presenters here today who come from all sorts of different aspects and areas of work, I think is a real, it's very indicative of the appetite that we have in Shropshire to try something new, to look at the positive identification and early offers of help in Shropshire, which I think will put us in good stead when we come to look at what offers do we make in Shropshire. Is there something else? And that's the end.